Hello friends, welcome to the channel Dewdear Academy. I have included the question paper discussion, that is SCT staff nurse examination, and I am discussing the part 6 of this question paper. So the first question is question number 71, that is which among the following is a potassium sparing diuretic? Options are Lasix, mannitol, Diamox, spironolactone. Which among the following is a potassium sparing diuretic? Options Lasix, mannitol, Diamox, spironolactone. So here the correct answer is option D, that is spironolactone. Spironolactone is a potassium sparing diuretic. Then question number 72, the difference between apical and radial pulse is called. Question number 72, the difference between apical and radial pulse is called. Options are pulse pressure, pulse deficit, water hammer pulse, carotid pulse. The difference between apical and radial pulse is called pulse pressure, pulse deficit, water hammer pulse, carotid pulse. The correct answer is pulse deficit. Option B is the correct answer. So pulse deficit is the difference between the apical and radial pulse. Then question number 73, that is the high pitched musical sound on expiration during a respiratory assessment is termed as. Options stridor, wheezing, grunting, crepitation. High pitched musical sound on expiration during a respiratory assessment is termed as. High pitched musical sound on expiration is known as wheezing. Options stridor, wheezing, grunting and crepitation. So among these the correct answer is option B, that is wheezing. Then question number 74, a client with severe burns is receiving H2 receptor antagonist therapy. The nurse understands that the purpose of therapy is to. So the client with severe burns is receiving H2 receptor antagonist therapy. The nurse understands that the purpose of the therapy is to. Options prevent stress ulcer, block prostaglandin synthesis, facilitate protein synthesis, enhance gas exchange. So which is the correct answer here? If the client is client is having severe burns and the patient is receiving H2 receptor antagonist therapy. So what is the purpose of administering this drug in case of severe burns? So it is administered in order to prevent the stress ulcer. So it is administered to prevent the stress ulcer. So the H2 receptor antagonist therapy is administered in severe burns in order to prevent the stress ulcer. Then question number 75, the angle of insertion of the needle while giving an intradermal injection is 15 degree, 25 degree, 45 degree, 90 degree. So what is the angle of insertion of the needle while giving an intradermal injection? So the correct answer is 15 degree. The angle of insertion of the needle should be 15 degree while giving intradermal injection. So these questions are all from Foundations of Nursing. Then question number 76. The most common symptom of bladder cancer is. Options are suprapubic pain, painless hematuria, dysuria, urinary retention. The most common symptom of bladder cancer is suprapubic pain, painless hematuria, dysuria, urinary retention. So the correct answer is painless hematuria. The most common symptom of bladder cancer is painless hematuria. Option B is the correct answer. Then question number 77. The abdominal distension and absence of bowel sounds after abdominal surgery indicates hemorrhage, paralytic ileus, intussusception, flatulence. The abdominal distension and absence of bowel sounds after abdominal surgery indicates. Correct answer is option B, that is paralytic ileus. It is indicating paralytic ileus. After the abdominal surgery, if there is abdominal distension and there is absence of bowel sounds, that is indicating paralytic ileus. Then question number 78. HbA1c is a blood test that reflects average blood sugar level over a period of approximately. Options are 0 to 1 month, 1 to 2 months, 2 to 3 months, 3 to 4 months. So HbA1c is a blood test that reflects the average blood sugar level over a period of approximately. So it is mainly over a period of approximately 90 days, or we can say it is 2 to 3 months. Option C is the correct answer, that is 2 to 3 months. Then question number 79. In preparing a client for barium enema for the evaluation of colon cancer, the nurse should. So in preparing a client for barium enema for the evaluation of colon cancer, the nurse should. Options are: give a oil retention enema and a laxative on the day before, place the client on complete bed rest the day before the procedure, give the patient 2 tablets of antacid on the day before the procedure, give a laxative on the previous night and a cleansing enema in the morning. When preparing the client for barium enema for evaluation of colon cancer, what should be done by the nurse? Whether to give an oil retention enema and a laxative on day before, or place the client on complete bed rest the day before the procedure, or whether to give the patient 2 tablets of antacids on the day before the procedure, or whether to give a laxative on the previous night and a cleansing enema in the morning. So correct answer is give a laxative on the previous night and a cleansing enema in the morning. Give a laxative on the previous night and a cleansing enema in the morning when preparing the client for barium enema for the evaluation of colon cancer. Then question number 80. Immediately after cholecystectomy, the highest priority nursing intervention should be. Options are: encouraging the client to take adequate deep breaths by mouth, encouraging the client to do deep breathing and coughing exercise, changing the dressing at least BD, irrigate the T-tube frequently. Immediately after cholecystectomy, what is the highest priority nursing intervention? So whether it is to take adequate deep breaths by mouth, whether to encourage the client to take deep breaths by mouth, or whether to encourage the client to do deep breathing and coughing exercise, or to change the dressing at least BD, irrigate the T-tube frequently. So mainly the highest priority nursing intervention after cholecystectomy is to encourage the client to do deep breathing and coughing exercise. Okay, encourage the client to do deep breathing and coughing exercise is the highest priority intervention among these options given here immediately after cholecystectomy. Option B is the correct answer here. So these are the important questions of the question paper Sree Chitra Tirunal Institute for Medical Science and Technology Staff Nurse Examination. So I hope you will all watch these videos. These are all very informative videos. So thank you.